doctors. Today we are going to discuss about some radiological signs, and these signs will help you in making your uh, principal diagnosis, and it will somewhat give you an idea about the concerned disease. So what does it mean? CT scan, that is computed axial tomography, and it is an instrumental method. It is used to see your internal body, organs and abnormalities. So here I draw a funny image that someone holding a cat. So it is really easy to remember that CAT cat, and that is computed axial tomography. It was discovered in 1972 by the British engineer Godfrey Hounsfield. So let's go through some signs. And before going through the signs, there are some points which you have to remember, that during the procedure there should be no metallic stuff on the body of patient. So this image is showing that the metallic things are sticking to the valve. Here is on the point that most of the patient, they feel anxiety and they have claustrophobia of that apparatus. So it is very important to make the patient calm and relax by counseling or by giving medication. So it is very necessary. That is MS saying that although a bit off-putting, if at first the amazing bill managed to ease the patient's anxiety during the scan. So here again, that don't forget me in this god-forsaken donut hole. Some people feel they are having entered a dark, claustrophobic place from which there is no escape. They feel like a trapped rat. Hope you're not one of those. So some radiological signs, they are the Cobra head sign, bug bead sign, crazy paving sign, cobalt stone sign, comb signs. So a list of 25 signs, but there is more sign than this one, and these are the only sign of CT scans. Okay, there are a lot of signs of X-ray scanning, ultrasound scanning, and some other methods. Okay, MRI, like that. So the first one, there is Cobra head sign. So when we see the Cobra head sign, commonly the Cobra head sign we can see in case of ureterocele, most probably at the distal end of the ureter. They dilate it and it seems like a cobra head. Okay, it is also called as the spring onion sign, and the method and technique which is used in this purpose, that is the pyelogram, in which we introduce or inject the contrast material intravenously. The other sign, that is the apple core sign. The apple core sign is like somewhat related to GIT, and the pointing arrow toward the point, there is a whitish area, okay, which making the lumen narrow. So this whitish area might be a cancer of your colon, and the blackish area on both sides, they are the air-filled transverse colon. So here that the apple core sign we can see in colonal wall carcinoma, and the method is called as barium enema, and the contrast material which we use for this purpose is barium sulfate. So another point, that is crazy paving sign. So crazy paving sign is a CT scan image of your lungs, and this is because the thickening of the interlobular and intralobular septum. It may be seen in acute respiratory distress syndrome, pneumonia, acute interstitial pneumonia, pulmonary alveolar proteinosis, pneumonitis, chronic eosinophilic pneumonia, and good posture syndrome. The Tram track sign is also related to that of your lungs, and most probably is seen in bronchiectasis. Bronchiectasis is a condition in which the bronchiole, okay, they become dilated, the structure can be changed. So it is a structural defect, okay, and here they said that parallel wall opacities due to bronchial wall thickening, bronchiectasis, and pulmonary edema in case of congestive heart failure. And the causes for infection, and the infection should not be like as acute infection. The infection should be chronic infection. For example, there is a chronic bronchitis, or there is a chronic inflammation of your lungs, okay, lungs airways, and if it is persisted for a long time, so definitely it leads to structural abnormalities into the bronchioles. And cystic fibrosis is a congenital abnormality, and it also it has no complete treatment, so definitely it leads to such situations. Primary ciliary dyskinesis is also called as Cartesian syndrome, and congenital anatomical defects like Meniere-Cohen syndrome. Comet tail sign, it is like a comet tail falling from the sky. Okay, the sign has been originally described on chest radiograph. It is often by distorted blood vessels and a focal area of the atelectatic lung adjacent to the pleural thickening. The vessels are seen as a curvilinear soft tissues, densities, okay, extending from the medial margin of the atelectatic lung to the pulmonary hilum. When the vessels are multiple, thus there are multiple tails, the vessels are more likely parative than parative sign may be used. The sign is due to the contracted fibrosis, scarring, and shrinking pleural diseases with rounded atelectasis. Likewise, on CT scan, swelling of bronchi and the vessels extending from the hilum and converging on the atelectatic lung help produce comet tail appearance. So it is some sort of atelectasis. The other sign is gulf ball on the T sign. It is referred to a urographic pattern of the papillary excavations that may be seen with renal papillary necrosis. In papillary necrosis, the central necrosis and slodging of the papilla create a cavity that then filled with a contrast. So here it is the main problem is the dilation of the papillae due to some bacterial infections or some other cause. Okay, there should be necrosis of the papillae. So the material which is used here again, that is iodine contrast, and which is given intravenously, and the method is pyelogram. Fat pad sign is like a fat pad, okay, and is commonly seen in the pericardium due to some abnormalities. Okay, so here they said that pericardial effusion causes an enlarged heart shadow that is often globular shaped. A fat pad sign, a soft tissue stripe wider than 2 mm between the pericardial fat and the anterior mediastinal fat, can be seen anterior to the heart. Finger in glove sign, it is also related to that of lung airway abnormalities, and the condition is called as the bronchocele. A bronchocele is a segment of the bronchus that is filled with the mucus and completely enclosed, so the mucus cannot drain out. The causes, obstructive causes and non-obstructive causes. The obstructive causes, that is the bronchial atresia, neoplasm or neoplasia, intrapulmonary bronchogenic cyst, intralobular sequestrations, broncholithiasis. And the non-obstructive causes, that is asthma, ABPA or cystic fibrosis. So it seems like our gloves, okay, our hand into the gloves. So other sign, that is incomplete and open ring sign. So there are two things, that is the ring may be complete or may be incomplete. So completed ring we can see most commonly in the neoplasia or infections, okay, but in this case if there is demyelination of your brain, in that condition we can see incomplete ring sign. So it is relatively specific sign for demyelination, most commonly multiple sclerosis. So multiple sclerosis is the demyelination of central nervous system. And autoimmune, the cause is autoimmune most commonly, okay, they cause and this method is brain city. Mercedes-Benz sign. The Mercedes-Benz sign describes a triradiate pattern of the nitrogen gas within the gallstone, initially described on an abdominal radiograph and later in CT scan. In the case of calcaneus cholecystitis, as an acute abdomen, fissures, usually filled with fluid, are present in close to 50% of the gallstone. So it is related to the gall abnormalities, most commonly in calcaneus cholecystitis. And cluster grape sign is also related to that of the airway abnormality and also seen in bronchiectasis, that the dilation of the bronchi in approximately appear as a bunch of grapes. So it is there is also a chance to see in ultrasonography in the uterus when there will be the formation of hydatiform mole. So UGS, multiple cystic spaces in the uterus, hydropic swelling of the trophoblastic villi within the hydrated form mole. Cortical rim sign, it is just like a rim of your car tire or cycle tire. So it is some sort of infarction of the cortical surface of the kidney, that it is the subcapsular cortical infarction. Renal artery obstruction, the cause from embolism or thrombosis or dissections or renal vein thrombosis. So these are the causes. Okay, when the arteries obstruct, there will be no blood supply to the cortical region, so there will be sometimes it leads to diffuse cortical necrosis or infarction. And the method is on the A, the method is renal CT, and on the B, that is the renal vessel angiography. Bird beak sign. Bird beak sign is also can see in the GIT abnormalities when the tubes, okay, the GIT, small intestine or large intestine, they twist it around each other. So there is sigmoid volvulus. The sigmoid colon twists around its mesenteric axis, narrowing the lumen with a resultant varying degree of obstruction. So it is an obstructive disorder and it seems like a bird's beak. The causes are enlarged colon, abdominal adhesions that developed after surgery, injury or infections, disease of large intestine such as Hirschsprung diseases, and this disease is more common in children and it is a congenital disease. What is Cocoon sign is also related to that of the GIT, and it is caused due to secularizing encapsulating peritonitis. So secularizing encapsulating peritonitis, known also as an abdominal cocoon, has no obvious associated conditions. However, SEP can also be secondary to conditions that causes peritoneum inflammation and fibroblastic proliferations. For example, peritoneal dialysis related to condition or abdominal tuberculosis. Nipple sign, it is the abnormality of the vessels. So it is not specific to aorta or azygous vein or some other vessels, but whenever the vessel dilate or there will be some abnormality into the vessel valve, though definitely the pressure push it and a dilated area is formed, that is called as the aneurysm. So here I have the image of aortic aneurysm on the right side in CT scan, and on the left side that is the X-ray sign and the arrow pointing toward the aorta. So aortic aneurysm, the cause is definitely atherosclerosis, which causes the thinning of the vessel valve. Connective tissue abnormalities like Marfan syndrome, and when the vessel's connective tissue the loss, then definitely the vessel become thin and the pressure cause the dilation. And the method is CT scan and X-ray. Comb sign, it look like a comb that the vessels okay, here the arrows pointed toward the vessels will become dilated and it is prominent, very prominent. So the comb sign refers to the hypervascular appearance of the mesentery in case of the Crohn's disease. These form linear densities on the mesenteric side of the affected segments of the small bowel, which gives the appearance of teeth of the comb. The sign may be seen on both CT scan and MRI, and the causes, most commonly the cause of Crohn's disease is unknown, and the Crohn's disease is such a disorder of your GIT that can affect your whole GIT from your oral cavity till to the rectum. So some we can say that it is due to chronic inflammation of the GIT tract. Headcheese sign. Headcheese sign is also related to the lung abnormality, and it is most commonly seen in hypersensitive pneumonitis. The Headcheese sign refers to a juxtaposition of regions with 3 or sometimes more than 3 different densities or the regions of different attenuations within the lung. Okay, ground glass opacities, that is highly attenuations, mosaic attenuations pattern, that is low attenuation, and normal attenuation. So we can see that there are 3 different densities. Okay, density of high attenuations, low attenuations, and normal attenuations. So whenever these 3 densities we can see at the same region, so the image seen, that is hyperdense, low dense, and low dense, normal dense. Okay, so it seems like a Headcheese sign, so it is also a lung abnormality. Air crescent sign, it is most common in incisive invasive aspergillosis. Okay, and the cavity is formed and then the cavity is filled with the air. So lung cavity that is filled with air and has a round radiopaque mass. It is also referred to as monad sign, or it is called as monad also. Okay, so double duct sign. Double duct sign is commonly again the GIT abnormality, but it is not related to the GIT tract. It is related to the duct system. Okay, the accessory duct of the accessory glands duct, common bile duct and pancreatic duct. So in this case, there is the problem is related to that of the pancreatic duct and the common bile duct. Maybe there inflammation and thickening of the valve, so there will be the hyper dense area, and we can see thick duct like shape, like sign. Okay, the double duct sign refers to the presence of simultaneous dilation of a common bile and pancreatic ducts. Being an anatomical sign, it can be seen on all modalities that can visualize the region, including the MRI, CT scan, ultrasound, and endoscopic retrograde cholangiopancreatography. Okay, it is invasive method, that is ERCP. And what about the bear paw sign? It is related to the kidney abnormality we can see in ultrasound methods, and most commonly seen in xanthogranulomatosis and pyelonephritis. So the renal pelvis contracted whereas the calyxes are dilated. The ascending chronic bacterial infection of the renal parenchyma in the presence of granuloma, abscess, and collection of the fluid-filled macrophages. So it is somewhat related to that of pyelonephritis. It may be ascending tract or ascending bacteria which causes the inflammation of the renal parenchyma and causes the dilation of the calyxes. So when it dilated, it looked like a here we can see in this image. Okay, these are the black areas, and here they are the dilated calyxes. Okay, so it seems like a bear paw sign, and the cause is definitely, I said, is a bacterial infection, and the method is pyelogram. Again, intravenous contrast is used. And this is what the last one, that always respect your teachers, because they are the one who give you knowledge. Thank you.